So, in thinking of Josh Minus and his clinic, I was taken back to some of the things that we discussed last week in organizational development. And that in some ways, some of the things made me think of that because I think some of the things he brought up for his goals was looking at a cultural change. But even before that, I heard a lot of what his goals were for the clinic, but I didn't hear what the clinic's mission statement is. And without a mission statement, was there a strategic plan of what they were actually planning to do? Because I think that makes a difference. I understand that there's things he wants to do, but why was that clinic, if it's an independent clinic and there's lots of other independent clinics in the area, what is the need in that area that they house so many independent clinics? So that was one of the things that I thought of. But in going into what our first question is, I was thinking of process improvement and how they could work with the other groups since there are independent clinics in the other areas. Um, so I hear a lot of currently a simple structure, and he's planning for a transition to more of a functional structure. And I hear a lot of planning for the electronic health record. So process improvement to get to that point, I think he may be wanting to use that he's currently using a form of resource deployment, but like they said on page 441, but I think what he's really trying to do is get to be more of a collaborative network is what he's trying to get to. So instead of being, as I said, resource deployment, I meant resource dependency. So if he can get to more of that collaborative network, I think that would help him in doing that. And one of the ways that I was thinking of getting to that collaborative network is maybe we had talked about or read about in Borkowski and Mies 2022 about co-appetitions. So maybe that hospital that's 20 miles away, instead of giving up their independence, but helping them to fund their electronic record, use that co-opetition. That way it'd be more of a collaborative, they would still have their independence. The other thing I was looking at besides the process improvement was the looking at he was saying structural change if their current one is not being effective. And I think for all of his goals, if he's having to cut down his salary, that maybe he needs to rearrange the structure, and that's why I think the co-opetition would help. I also thought of training because of some of the things he said of when they couldn't get part of it completed, that financial person and trying to their provider satisfaction and wanting to invest in improvements and stuff, that maybe what he needs to do is in working with that training, not only just taking the time so he can have training the providers, but on all of these new systems. But before he does that, improving the office operations and servicing the patients and trying to get the physician and staff satisfaction, I think he needs to work on buying in, getting everyone to buy in. And I think where that training will help with that. And I also think performance management will also help him get to that particular part. So those are some interventions that he can do. Because with that performance management, they would be looking at their strengths and their weaknesses. I think in looking at the strengths and weaknesses, it would help them use the Lewins and then freeze. But I think maybe for them, because there's so much positive that's going on there, I think actually what they do need to use is the appreciative inquiry process. He's already having, it sounds like, a lot of stress in the situation, but he is so invested in it and he's got such good context already. If he can take what he has and make it go further, which I think is what the appreciative inquiry will allow them to do. I think that will help them get further in redeveloping what they want to do. They would recognize the positive attributes and help them ask the questions. Ask the questions that would help them develop the mission statement, ask the questions to do a strategic plan. Ask the questions like which of those things are things that we can change and things that we cannot change as far as the clinic. References chapters 19, 20, and 23 for Barkowski and Barkowski N. and Mies K.A. 2022, Organizational Behavior Theory and Design in Healthcare, Jones and Barker Learning.